Really excited to be joined by Maggie Sauer. Maggie, what's the big deal around telemedicine? Why should we get excited about this?
It finally gives us an opportunity to reach folks in rural communities that may not have had access otherwise. And with physician shortages and healthcare shortages, this gives us an opportunity, gives us a chance.
So I gather that a bunch of folks who are watching us at this moment are thinking, well, surely there is a dearth of specialists in rural areas, but in North Carolina, why telemedicine for primary care?
Well, over the years, a number of our physicians have either retired or people have chosen not to go to rural areas. And so we've been seeing kind of a steady loss, if you will, to primary care physicians in rural areas. So without the ability to recruit and retain folks there, we really have to figure out new and innovative ways that we can make sure people get access to the care that they need.
And McDowell County is using school-based care to provide this telemedicine. How excited are you about that as an innovation?
Oh, it's astounding because when you impact children's health at school, it impacts what happens to their parents in terms of having to leave work, to take them someplace. It makes sure that kids get to stay healthy and they get to stay in the class. So, and it also gives the opportunity for their parents to begin to see what a primary care home could look like for their kids. And when their kids' health improves and stays improved, it also impacts the entire family.
So talk to me a little bit about rural health in North Carolina as we're looking at the outcomes of a program like this one in McDowell County. What should we be looking for in terms of long-term trajectory?
So the things I think that are important to look for are children who receive good health care in the early years will continue to realize good health outcomes in the future. So it's an investment in our rural communities. And those investments mean that even when they have their own children, they'll understand what good health care can bring as well. So it's part of it is quantifying, that people got a checkup, they got their vaccinations, they got the kind of well care that they need, but having an opportunity for those kids to go and see someone that they trust, and that person may be via a television, a screen. And kids are really excited about that. They do that all the time now, so
Indeed.
it's very natural for them to do it. And so we just want to make sure that families can continue to be as productive as they possibly can because parents are able to stay at work, kids are able to stay in the classroom, and that perpetuates a good standard for care in the future.
You're with North Carolina's famed Office of Rural Health, oldest in the country, is that right?
That is correct.
How long have we had an Office of Rural Health?
Our office was the very first Office of Rural Health in the country, and it's 45 years old this year. We were blessed by having people who really cared about rural health come to the state and say, other countries have really difficult health situations. Jim Bernstein was a Peace Corps volunteer, and he came back to the United States and said, wait a minute, we have things in our own state that resemble some of those conditions. So we need to have an office not just broadly around healthcare, but focuses on our rural communities, residents, and friends.
And so now as you look into the next 45 years, how do you see technology playing out in terms of expanding access to care and changing health outcomes for people in rural communities?
Well, one of the things that we hear frequently about is just access to primary care. We also hear about the lack of behavioral health care in rural communities. And frankly, the Medicaid transformation that we have right now really supports the use of technology to gain access. So really, it's more about how can we make sure that there's broadband available in those communities, and that it can be a nurse practitioner, a PA, physician on the ground to make sure that people are making those connections so that what ends up happening is that we really won't have any blank spots, really, in the state in terms of how people can get to care. Yes, we want to make sure that people can get to their primary care physician and they get that regular care, but if they're unable to have someone directly in their community, it's most important that they're seen. We have all kinds of screening things, like with mammograms with women, other kinds of preventive procedures that can keep people from getting sick. And so sometimes you just need people in the community, for instance, who can, maybe it's a nurse or someone else who can make that connection in the community. And then if you have a telehealth connection, that trusted person can help them feel comfortable with the person on the other end.
So I think I hear you saying it's not either or. We're not going to a world where all of our healthcare needs are going to be delivered via technology.
Correct.
That relationships are important, that being able to eyeball someone you trust with your health is important. Is that
That's
right?
absolutely correct.
So given that, what would you say to the viewer who is considering specific gaps in coverage in their own geography right now and wondering, how do we take advantage of telehealth? How do we use that to augment what already exists in our community?
Well, one of the things that I think is really important is with the Governor's Hometown Strong initiative, really trying to draw the departments in state government together to work in a really braided, concerted fashion. And what that means is that we're working now with the IT around broadband, because we really want to make sure broadband is good for so many things. Related to health, we hear all the time about recruiting providers to rural communities, and they can't necessarily find a job for the spouse. Well, guess what? If we had broadband, somebody can work remotely. Huge, huge incentive for people to be able to work in their community. It helps education. It helps people who are working just in terms of developing businesses. And what we hear more and more is that people want to remain productive in their workplace. Well, guess what? If you don't have to leave the workplace for a doctor's appointment and you can have it right there, you know, that means that some of these communities that are really wanting increased rural economic development can have that.
Do you know how many employers right now are going, woo, woo? Because this actually means that people don't have to leave the workplace in order to get a routine check-in, right?
That's right.
Okay.
That's right. And, you know, there was one community that we went to that said last year during the flu season, there was a 50% absenteeism during the months of January through March, because if the employee wasn't sick, they were trying to take somebody to the doctor, trying to see their kids. So kids, you know, if they're able to be seen at school, if you're able to have somebody who can do that in the community, or you're offered a flu shot or some other kind of preventive measure at your workplace, or support, just calling somebody on the phone and being able to, or see somebody virtually, keeps people at work. So it's, so broadband, you know, I don't think it solves every issue, but I think, you know, we're working with DIT to look at specifically where are those opportunities and nodes to kind of build that into the rural infrastructure.
Maggie, what have I not asked you that I should, because our viewers need to understand this?
Well, I think one thing is when people think about rural, they think about the things that rural communities need, not what they have. And rural people have passion and heart and are so engaged in their community and helping one another that anything that we can do in terms of providing a virtual connection to that allow people to stay engaged will be really, really important. And grandparents now FaceTime their grandkids from across the country. So, you know, I've had people say, older folks are probably not going to be interested in this, and I haven't seen that. We've come to a place where people expect to see one another, And to me, the more that we can develop those relationships and keep those relationships going, no matter if there's a physician or a healthcare provider in Raleigh who's, going and helping his fellow colleagues out in McDowell County, that's what this is all about. And I think that will never be replaced.
Love it. Thank you so much for being with us, Maggie.
Thank you for having me. I really appreciate it.